Hello, my name is Daniel Stillwell, and I'm the editor of the IFTA e-newsletter. We're here in Aberdeen, Scotland at the IFTA Congress 2025, and we have with us today Umaimah Maryam and Adam Jones. Umaimah was one of the selected student scholarship recipients, so we're honored to have her here and her mentor. So you're giving a presentation today. I'm excited about this. Tell us a little bit about it.
So 2 years ago, I came up to Dr. Jones and I told him that I want to work with Afghan refugee women because apparently they're very underrepresented in research. So there's little research with Afghan people, but there's even less research with Afghan women. And that just means that they do not get represented in the clinical practice at all because nobody understands their cultural nuances, nobody understands where they're coming from, so there's a barrier to even seeking treatment. And I think the way to go about it is to go in and learn about what their experience is like, to learn more about them so we can do something with them that would work for them.
Okay. Yeah. So what did you find? So
we found a lot of interesting things that we did not know before, obviously for obvious reasons that there's little research, but I thought there wouldn't be so much that we would not know because we hear so much about this population in the news, and turns out a lot of what we hear in the news is not what their experience is, which was eye-opening for sure. But we learned that in order to work effectively with them, and I think a lot of family therapists would be nodding their heads when they hear that, we need to bring the family in. And in the absence of the family, which so happens when somebody is displaced, community replaces the family. So I've seen that with other refugee populations that I've worked with from Myanmar and from the tribal areas in Pakistan, that people show up for each other and then give sort of a new definition to the notion of family and the notion of home in the absence of both.
That makes sense. What differences have you seen develop?
For the Afghan population? So in terms of our work that we're doing with them, we saw that yes, the women are very marginalized, but I was very confused, perplexed in the beginning that the gender oppression and marginalization is not coming up in their personal interviews. And then I started interviewing mothers and daughters together, and I saw how beautifully intergenerationally that is seen, that I don't want my daughter to live the story that I've lived. And I think it's very interesting because coming from a Eurocentric lens, the way we're trained, we look at the power dynamics in the family relationship, like that they're inherent there. And we feel like, oh, so whoever is in the submissive position would have some resentment for the people who are in the dominant position, but it doesn't always show up like that in research. And so I went up to Dr. Jones multiple times and I'm like, why are we not seeing that until we saw that intergenerationally? And it's beautiful. I think their resilience, because it's amazing. It's not a story of despair. It's a story of resilience. Of living through 4 decades of war, they still want to fight. They still want a better future for their girls. They still want their daughters to have the right to work, to have the right to education, which might seem very basic to a lot of people growing up in countries that have not lived through conflict for so many years. But these little things are privileges for this population. And in terms of clinical work, when we go in and work with them clinically, I think it's very important to make sure that we include the community. We integrate their spiritual practices. We integrate their cultural healing practices. It's important that we go in and meet them where they are and not try to pull them in and bring them where we are.
So you were studying refugees from Afghanistan. Have you, and specifically in the U.S., and I know that oftentimes the U.S. is not the first stop along the way in a refugee process. Did you see anything regarding that journey, sometimes taking years to end up at a place like Texas?
So interestingly, the population that we worked with, a lot of them came in after the 2021 withdrawal of the forces.
Okay.
So US was actually their first stop because these people were working with the troops.
They were working with, right.
Yeah. But I did come across some people who'd been to Iran and who'd been to Pakistan. And so it's interesting, people who'd lived in Iran had a more empowered view of women's position in the society, for sure. And those women had a little more agency, had a little more, empowerment experience even prior to coming to the US. But it's interesting to note that even though they reflect very positively on the experience of empowerment in resettlement in the US, it comes with its own challenges. Yeah. So if, for example, you're now finally getting to drive, you're now finally getting to work, but you have to learn the language first. You have to build all the skills that are required to be an adult and go out in the society and earn for yourself and even exist in public places.
Okay. We have an international audience from all over the world. What lessons do you think you have picked up on clinically that could apply to many cultures?
I think that would be something that you'd want to talk about.
Well, something that we really learned as we've even continued working with this population a little bit is how important it is to really develop trust. And there are a lot of ways that you can do that in working with refugee populations. One, just being aware that mental health treatment is very stigmatized. There are a lot of beliefs or concerns about talking to a therapist or getting treatment and a lot of different ideas about what mental health problems are. And
even are, right?
Yeah. So even there are a lot of barriers even to being able to work with communities. And so those who are interested in being able to help and serve, and what we need to be able to do as organizations and as therapists are find ways to be able to build trust with the communities. And Umaimah is a great example of this, having reached out to a lot of these different organizations and really listened to what their concerns or worries are about participating in research and taking the time to answer a lot of their questions. Letting them, when it comes to therapy, taking some time to let them voice their concerns about therapy and make sure it's very clear the choices that they have through the entire process. And through the process, it's also really important to be open and curious about their culture, to integrate healing practices throughout that are already inherent within their culture, like dancing and movement and family or community involvement. Finding ways to using the resources that are already really inherent in this population to be able to find new avenues to explore solutions and give them opportunities to navigate a really complex transition between very different cultures.
Well, and you used the term resilience earlier, and we know that one of the foundational elements is to use the resources that are already there. So I like that reminder. I also like the idea of trust being something you also care about, which is attachment dynamics.
Yes.
How do you see those working in a refugee population?
So we're actually, we were talking about working from an attachment lens, an attachment parenting lens with this population. I think the attachment ruptures that happen, especially with the younger population that we were working with, it's harder to heal from that. It's harder to reach out and accept help. From your own parents, from your own community, let alone from a stranger. So the attachment ruptures are definitely there, and that is why our next focus is to work with them from a parenting angle, which is going to be trauma-informed, culturally sensitive, and also attachment-focused.
Nice. Any hypotheses or expectations?
We've actually started working with them. We've started having, we're doing a 6-session workshop. So we had our first last week. And what we're trying to look at is how their own perception of their trauma gets in the way of them parenting effectively, how violence in the families, which is obviously very prevalent in cultures where the family has witnessed perpetual violence in the society, of course, it is reflected in the family dynamics as well. So how to navigate that, how to move past that, how to create a safe space and not a place of judgment for these families so they can actually heal from that, and how to create a space of healing from an attachment perspective for those little children who definitely never experienced safety the way we would want our children to experience safety since the beginning.
Okay, all right. Any other lessons that you feel like you can draw from, or you want to hypothesize, speculate for the people watching?
I think when you go and work with a population like that, make sure that you create space for community, because community is it for them. It's their way of surviving. And that is even other research that is conducted in Europe has shown that the single most significant protective factor against despair and adversity for these populations is community. So I'll tell you an interesting example. I was working with Myanmar refugees who were children of about age 10 and under. And I reached out to an NGO, and they said, oh, you can go to this particular place, which is an alley, like a back alley in somewhere in the city center, and you'll find some boys and go talk to them, and they'll lead you to the children and you can interview them. So I went and I talked to those boys, and I'm like, what are you doing here? You're 14, 15, 16 yourself, what's going on? And they said, well, we don't have documentation here yet, we're still waiting to be placed somewhere, so these children cannot go to school and their parents are not educated. So what we've done is we've started setting up these schools in the alleys in this area where we are, and we're teaching these younger children. And that just showed me, and they're not just teaching them, they're like bringing food for them so they can eat, and they're helping them change, and they're even trying to help with the younger children, because in these communities the older siblings would be looking out for younger children. So the younger children are somewhere there, and one of them is looking out for the younger children, and sort of a daycare, makeshift daycare situation, and then they're running that school. And I think that's as powerful as it gets. It's a beautiful story of how people create a new definition, new notion of family when they don't have a family to turn to.
Excellent. All right. Well, that's a really good note to end on. You're here in Scotland. You doing anything fun?
Did you do anything fun?
Oh yeah, we've most of the traveling has been on the sightseeing has been on the front end of the trip, and so London, Edinburgh, we've had a great tour of some of the different areas of the country. It's been a lot of fun.
Yeah. I love going to churches, so I've seen a lot of cathedrals, and where I'm staying, fortunately, there are quite a lot of them.
Yes.
So I've been having a lot of fun doing that, and I'm heading to Edinburgh tomorrow.
Well, there's some good stuff down there as well.
Yeah, I've never been there, so I'm pretty excited for that.
Cool, very good. All right, well, Dr. Jones, future Dr. Miriam, this is great to have you here, and thank you for joining us here in Scotland.
Thank you for having us.